Star 17 years old female present with a sudden fecal history.
يلا زينب.
brain MRI scan of multiple sections in coronal and axial sections. Showing large heterogeneous lesion بالليل.
هسه أحسن.
high diffusion not restricted.
عندك كونتراست؟
إيه ستار.
طلع الكونتراست نشوفه.
heterogeneously enhancing lesion multiple. اوكي
أرجع عليها.
يلا زينب هسه شفتيها تقريبا؟
نعم. المين او البالك اوف ذا فايندينج اكو بالليفت سيربيلر هيمسفير large lesion with surrounding edema or mass effect located peripherally in the hemisphere with surrounding in the mass effect or another lesion nearby. Other lesions supratentorial هذني كلها ring enhancing lesions وكلها surrounded by edema.
وبعد شكو الفنتركلز بيها
ما له dilated
لانه اكو بريشر على السورس.
نعم اكو بريشر افكت والفيس كاب.
تدري شنو نفكر اذا شفنا الشكل؟
كومنيجيال انهانسمنت.
اي
كلها all together living features تمشي كانما ايضا يعني ميتاستاسيس الإديمة مو كلش يعني ماسيف.
اي
او التيبي جرانيلوماز.
الصوت زينب الصوت ده يروح.
اغلب ديفرنشال دايجنوستس هو ممكن تيبي جرانيلوماز خاصه هذا بدنا نشوف التومانيجيال انهانسمنت.
زين انت ليش فكرتي بالميتاستاسيس والايج يانج ايج؟ ما يخاف يانج ايج وهذه
فينتج اتاك صدق فينتج اتاك صار
دائما من انطيك فد هيستوري مال سلين اكيوت فكرتي ميتاستاسيس بيانج ايج ومالتيبلسيتي مال ليجن وهالشكل. ليش خليتي اول شيء جرانيولوما قلتي وبعد شنو اكو اذر ديفرنشال دايجنوستس؟ يعني تي بي مننجايتس وتي بي with the cerebral differential diagnosis.
النيوروسيستيسيكوسيس اللي هو ما عندنا يعني احنا ما نشوفه عندنا.
اوكي شكرا جزيلا. هسه اللي ويا التي بي شنو اللي ويا التي بي؟
المالتيبلسيتي والرينج انهانسنج والسراوندينج اديما قليله واللي عندنا الابتومنديال انهانسنج.
بالضبط واضح زين. هسه هذا ليجن اللي سيربيلر ليجن
هي واحده من الاثنين. اذا هو يعني تي بي نقدر نفسر بواحده من الاثنين، اما هذه لارج جرانيلوما او تي بي
اساس واحد هاف تو اكسكلود لانه شو النيورو يعني السي ان اس تي بي يجي اسمه يعني اوف ديفرنت هذه من ضمنها الابسس فاحتمال هذا ابسس او يجي
هو شكله يشبه الابسس يعني كولاجين.
زين وبعد الابسس والجرانيولوما والابتومنجيال انفولفمنت اكو
ممكن ككومبليكيشن اوف تي بي يعني تجينا انفاركشن هيدروسيفالاس هاي اذكرها.
مروه ممكن التيتو بلا زحمه عليك التيتو خلينا نشوفه. دقيقه اقفل على الليجن واقفل عليه. فيدنا شيء تيتو زينب بالتي بي اذا هو تي بي فيدنا شيء؟
ماذا يحضر مستر؟
نعم
دكتور
شي
هذا
يفيدنا التي 2
يفيدنا.
كلاسيفيكيشن ممكن يعني تبين الارتفاكت اكثر بالتي 2.
دكتور التي 2 يختلف عن
كازيتنج.
التي بي، الميدل بارت مالتها هايبو بالتي 2.
بالضبط. اي نعم نعم.
فدائما
هي كازيتنج فروم نون
التي بي يبين هايبو بالتي 2 على
بالتي
عكس
2.
المتوقع يعني.
بس
يلا مروه احكي لنا على الكيس بابا.
old female present with sudden fainting attack يعني show multiple and infratentorial surrounding by edema يعني تقريبا grade 1 and associated with the leptomeningeal enhancing. البيشنت سوينا لها CT chest وقتها وشفنا هنا multiple large calcified with apical fibrosis. هنا صارت apical fibrosis و 3 embed lymph node و calcified. يعني هي كان differential diagnosis ممكن انه تكون lymphoma او unlikely انه lymphoma lymph node calcified without treatment و not restricted اللي هي طبعا اللي TB كانت multiple و calcified lymph node. Approximately 10% of all patients with TB have CNS involvement, while synchronous extraneural may serve as important clue to diagnosis of the CNS TB. A spectrum of lesion in the CNS TB range from TB meningitis and tuberculoma, as in this case, and miliary and leptomeningeal granuloma, TB abscess and vasculitis and infarction, cranial neuropathy, and lastly calvarium TB subdural with epidural abscess. TB meningitis is the most common manifestation of all TB in all age group, either came from hematogenous spread or rupture of subependymal focus. See by imaging, like in this case, contrast enhanced CT in patient and meningi with a dilatation of the ventricle. والMRI was superior than CT in imaging TB meningitis, especially in initial investigation. Communicating hydro mostly common complication of the TB and is caused by block of the basal cistern by an inflammatory oxidate. In some cases, hydro may be non-communicating, resulting from obstruction due to the tuberculoma or rarely tubercular abscess. Ischemic infarction are also common, seen in about 20 to 40 of cases, mostly within a basal ganglia, an internal cavern or occlusion of the small perforating vessel, particularly lymphostrate and thermoperforate artery, causing necrotizing arteritis. On the other hand, cranial nerve involvement seen in about 70–40% of cases and mostly affecting TB meningitis may also cause dural venous sinus thrombosis with a result in hemorrhagic infarction. Rarely, TB may present an isolated dural venous sinus thrombosis without any evidence of meningitis or its complication. This case, patient with meningitis and show bilateral lacunar infarction seen in restricted on Dewey. There is a diagnostic triad of the TB meningitis. When it is present, it is considered almost 100 specific date and infarction and hydrocephalus. Also, magnetization transfer spin echo imaging following a contrast injection superior than conventional post-contrast imaging in demonstration meningeal inflammation. Quantitative magnetization transfer ratio or chronic meningitis, as we see later. Significantly lower MT ratio is seen in TB meningitis than biogenic and fungal meningitis, and significantly higher MT ratio than viral meningitis. Tuberculoma, most parenchymal lesion in the CNS tuberculoma may be solitary, multiple as in our case, or miliary, and may be seen with or without meningitis. May be seen anywhere within the brain parenchyma, mostly in frontal and parietal, while in children predominant infratentorial. On density, on contrast, enhanced may present a pattern like ring-like enhancement or less likely nodular or irregular non-homogeneous enhancement. A central nidus of calcification within a surrounding ring-like enhancement, known as a target sign, suggestive a diagnosis but not specific. As seen in this case, there is in surrounding by contrast ring enhancement. هنا طبعا تختلف عن neurocystocercosis in non-calcification in larger. Non-enhanced MRI show mixed, predominantly low signal intensity lesion with a central zone CT edema on T2 or flare. The central high signal intensity zone corresponding to causation necrosis and low signal intensity at the cap fibrosis and lower water content. Like contrast CT, post-contrast MRI usually show a pattern of ring-like enhancement. هنا solid يعني ايزو هايبو ب T1 هايبر ب T2 تاخذ homogeneous enhancement. The difficulty عندنا هي بالكازيتنج salt granuloma whether with liquefaction or not usually اللي هي hypo T1 and hypo on T2 اللي شفناها بالسيربيلم and relative hypo intensity due to the CNS central core resulting in greater cellular density than brain parenchyma. هاي هنا الكيس اللي هي تشبه الكيس مالتنا بالتي2 السنترال هو hypo و after IV contrast take multiple ring enhancement on the right side with the basal cisterna enhancement. هذا الكازيتنج جرانيولوما with the liquefaction يصير السنترال بالتي2 هايبر وبوست كونتراست ياخذ رينج انهانسمنت. differential diagnosis in TB essentially infectious with the neurocystosarcosis, cerebral toxoplasmosis, and CNS cryptococcus bacterial cerebral abscess, neurosarcoidosis, and cerebral metastasis, and lastly CNS lymphoma. This T2 MRI biopsy proven right parietal tuberculoma, low signal intensity REM of the lesion and surrounding hyperintense vasogenic edema. Another representation miliary axial T1 MRI multiple small high intensity foci within both cerebral hemisphere. On imaging, a TB abscess may be indistinguishable from casating TB or biogenic abscess. However, a TB larger than 3 cm in diameter and has a peripheral edema and mass effect. Differentiation TB abscess from biogenic abscess can be done with an MRI spectroscopy and magnetization transfer imaging. On spectroscopy, TB abscess does not demonstrate amino acid peak as compared to biogenic abscess, which show amino acid peak of 0.9. And magnetization transfer ratio in TB abscess is lower than that found in biogenic abscess. This case 22 old female with a miliary pulmonary TB as showing enhancing TB abscess. This is another case of the اللي يختلف هنا عن ال pattern of enhancement. طبعا إذا immune compromised راح يصير thick wall. Another entity TB encephalopathy, a syndrome excessively present in infant and children. Pathology diffuse edema, cerebral white matter, and loss of the neuron and serve unilateral or bilateral cerebral edema. And the presentation came with a coma and on T2 imaging hyperintensity white matter suggesting a myelin loss. The patient also showed diffuse alteration of the magnetization transfer ratio in white matter, which revert back to the normal after clinical recovery. This is a patient with TB encephalopathy, show diffuse brain edema and hyperintense abnormal signal intensity associated with hydrocephalus. Another entity of post-contrast focal, tense focal gyral enhancement region of the left sylvian fissure with a surrounding edema. Vasculitis and infarction is initiated by direct invasion of the vessel wall by Mycobacterium and may result from vasculitis is more common in infant and children and most frequently in basal ganglia, cerebral cortex, pons, and cerebellum. MCA territory who was the most affected infarction and frequently bilateral. Lastly, calvarial involvement in TB is rare, and TB was estimated to present 0.2 to 1.3 of all cases of the skeletal TB. About 50 of cases reported in the literature were in patients were younger than 20 years. The disease is rarely seen in infants and believed to be a calvarian TB occur by hematogenous setting of bacilli into the fluid space. This case shows TB abscess with an epidural and subdural environment with last CT image show calvarium osteomyelitis. Thank you.